With us to discuss the health impact of this all is OBGYN Dr. Jeinefer Gunter. Dr. Gunter, thanks for joining us. So according to Guttmacher, nearly 1 in 4 women in the United States will have an abortion by age 45. So what does this ruling mean to 1/4 of American women and girls?
Yeah, I mean, it means poverty. We know lack of access to having abortion increases your likelihood that you will live in poverty. It means an increased risk of maternal deaths from illegal abortion, from complications during pregnancy that we now can't manage because there's fetal cardiac activity, and maternal death from pregnancy complications. It also means people who have a miscarriage might have difficulty getting access to drugs to treat that, or an ectopic pregnancy. And it could even impact contraception. It's absolutely far-reaching and devastating.
Well, let's talk about the pregnancies that are complicated, complication issues, health issues. What does the ruling mean for those patients?
Well, it means in many states, doctors won't be able to do anything because many states don't have a health exception. But even if they do, they're uninterpretable. I've personally been in a situation with a sick patient who had a serious medical condition, and her physicians felt her health would be improved if she were not pregnant. And we had a law where we couldn't do abortions at our medical facility. And I had to call the politician who wrote the law at home to get permission.
I know someone who had a very problem pregnancy where the brain of the fetus was actually growing outside of the skull. There was no way that this baby was going to live, and the mom got an abortion. That mom would be forced in some of these states, like South Dakota or Oklahoma, forced to carry the child to term?
Right. And though imagine, say you're pregnant with, and so now you have all these people touching your belly and asking you, about your baby that is going to be born to die. But imagine if you get a pregnancy complication. Say you get really high blood pressure at 32 weeks, and then we want to deliver you early, but that fetus is going to die when it's born. So have we now done an abortion? I mean, the laws are really uninterpretable.
Something else, and you touched on this, I don't know if folks understand, quite often a woman who miscarries has to then go get an abortion. Can you explain that?
Yeah, absolutely. So sometimes when people have a miscarriage, they have what we called, a missed abortion or an incomplete. And so the process starts, but it doesn't finish. And so we prescribe medications, the same medications that we use for medical abortion. There have already been women reporting online. I've seen reports on Facebook of them showing up to pharmacies, asking for their prescription and being turned away because the pharmacist was worried they were having an abortion.